I'd like to ask Rafia Khan, ma'am. Ma'am, as you know, as we all know, anesthesia is one of the branches where there is high risk of getting a lawsuit. So, how to face these threats of medical legal cases, ma'am?
Thank you for the question, Dr. Venkatesh. I think as ma'am has rightly said, and of course Dr. Bhushan sir has rightly said, that communication is one of the very important keys in anesthesia as well. In fact, for that matter, any medical legal purposes. And as sir has already mentioned, that we as anesthetists also, prior to taking up any high risk case, we explain the attendance, and first we take in written also, like the usual procedure. And if there is any attendant who's very, what should I say, not ready to accept complications, and not able to understand, not understanding the risk, and not giving consent, and but it's really important, but the procedure is important, then one thing we simply say, it's all right, then okay, fine, then you, if you want your patients, you don't want your patients to get treated, it's very simple. We try to explain in as simple words as possible in their language. But still, if they're not able to understand, then it is their choice. See, we cannot force anybody to go undergo any procedure, any risky procedure. Of course, it's their relative, it's their family member. We cannot impose anything on them. It's their choice. They are coming to us by their choice. They have this problem, and we are offering them the treatment. And if they are not able to understand the complications, the consequences, uh, even in the most simplest languages, we can explain to them. We are explaining them even the risk, the percentage of the risk involved. But still, if they are not, then it's very simple. It's their choice. If they want to abandon, they don't want the patient to get operated, or they don't want the patient to undergo any procedure in ICU. So very important thing for all medicos is getting consent done, and usually it's very difficult for the newcomers, the first year residents, for make the attendants understand. So it's just a suggestion that it would be better that for our ease, at times we ask our first years to, okay, जाओ भाई तुम समझा दो. They're newbies, so they don't know how to communicate, and this may create miscommunication between the attendants and the patient and the doctors. So it's better, since they're in their learning phase, they are, of course, they can make mistakes, but why, in such critical situations, in such high risk patients, it will be always better that some senior person go explain, and that junior resident should stand there, try to understand, try to make note of the kind of words, because we cannot be very upright and upfront in using very straightforward words. We need to be very polite with them. Of course, they're suffering from a trauma. They're undergoing a lot of stress. Their patient, their family member is under a lot of stress. It's a disease. So it's very important that a senior person goes and takes the consent and explains the attendant, just for the easiness, and this everything shouldn't be left on the junior resident, I would like to say. And of
Okay.
course, getting in written, it's very important these days, because it's the only thing that you have in hand.
Agreed, ma'am. Totally agree to it.